I'd like to call to order the April 23rd, 2024 Health and Ed Committee. And this is my anniversary tonight, so shout out to Melissa Dodd, 36 years. So sorry I'm spending it with you. First order of business is call the roll, please.
Commissioner Oliver?
Present.
Commissioner Davidson?
Here.
Commissioner Wilson?
Here.
Commissioner Boyd?
Here.
Commissioner McMurray?
Here.
Commissioner Gooch?
Here.
Chairman Dodd?
Present. Vice Chair Wilson, have you had a chance to look at the minutes? You're having trouble hearing me? Can you hear me now? Can you hear me now? Chairman Wilson, if you would consider the minutes, please.
Thank you, Chairman. I have reviewed the minutes from our last meeting. I find them to be in order, and without objection, I move for their approval.
Second. All in favor say aye. Aye. Motion carries. Thank you, Vice Chair. I was informed we have no public comments tonight, so we will move on to Director Cumby and the Health Department.
Thank you, Mr. Chairman. Byron Cumby, Director of your Rutherford County Health Department. Hopefully you have our March outreach report available to you there electronically. In keeping with our mission to protect, promote, and improve the health and well-being of people in Tennessee, we protect with our disease intervention efforts, immunizations, and environmental health. We promote in that second column with our health outreach, diabetes outreach, community participation, vital records, and then we improve with our primary care services, dental, WIC, and family planning. All of those programs are operational, performing as expected. Flu and seasonal respiratory illnesses continue to track downward. We're very pleased to see this. We've seen 3 consecutive weeks now below the baseline in Tennessee of outpatient visits for influenza-like illnesses. The rate in our region is currently considered minimal, and there are 3 classes above that, so that's about as low as you can go. Their flu shots are still free and available as a walk-in basis in our health departments from 8 to 10 or 1 to 3, Monday through Friday. It was about last year around this time that we did kind of see the flu season tail off. So we're kind of excited about that. With COVID-19, good news in that area as well, trending downward nationwide. Our COVID-19 status in Rutherford County remains low, according to that CDC hospital admission metric. We do continue to offer that testing at our health departments, free to the public by appointment. Just give us a call there at either location, Murfreesboro or Smyrna. The Tennessee Department of Health does have their community support hotline. It's available to take questions about COVID, the COVID vaccine, the new booster guidance that was put out a couple of weeks ago. And that phone number is 615-770-6940. 615-770-6940, and that's operational between 8 and 5 Central, Monday through Friday. The COVID-19 vaccine we currently stock is Moderna. We continue to have the Pfizer available for those pediatric cases. We have some upcoming events I'd like to tell you about. Friday, May 24th, the Rutherford County Health Department will host a child health fair from 10 a.m. till 2 p.m. at our location here at 100 West Burton Street. That day will be a partial school day. We're hoping that families will stop by after school's out to participate. There'll be fun activities, food, refreshments, and free dental screenings, as well as the opportunity to get any vaccines necessary for school attendance in the fall. Our target age there is K through 7th grade, but all are invited for that. There will be fire trucks, police cars, the library bookmobile, and we'll be doing car seat safety checks. And also, if you bring a coat to donate for our Coats for Kids program this fall, you'll be entered into a raffle to win prizes, and there's some great prizes there like movie theater tickets and so forth. This is actually a return to health fair from days past, and it was inspired by some of our long-term staffers that had really fond memories of health fairs we did in the past. So it's a return to form for us as we showcase some of our in-house services, and we're glad to see that come around. And then in June, our 9th annual community baby shower will be on Saturday, June 22nd. It'll take place once again at the Patterson Park Community Center from 10 a.m. till 1 p.m. It's open to any family with it that is expecting or has a newborn in the household. There will be informative classes on infant CPR, breastfeeding, safe sleep, and over 50 of our community partners and vendors will be offering resources to these growing families. Anyone interested can call the health department at 615-898-7880, and we will have information on our website as well and social media shareables to go in the coming days. And Mr. Chairman, that concludes my report.
Thank you. Commissioner Davidson.
Hey, I just wanted to see if you're going to have a flyer for the health fair.
Yes.
Can we have that sent to us so we can share that?
I'd be glad to get that out to you all. I know that Ms. Lisa Kay, our PIO with the county, has put that on the Facebook, but we'd be glad to get that directly to you so you can share that. Thank you, Commissioner.
Sounds amazing.
Question.
Commissioner Oliver.
Concerned about your tuberculosis numbers, can you talk about those and the implication there?
What I've been told in the past from our TB team, and our TB team does cover, they get referrals from the region, is that there's a natural ebb and flow to these things. They haven't alerted me to anything that would be of any concern, but I could definitely check with them and just to make sure that these numbers are on track and reflective of what we want to see.
Okay, because, yeah, this year's March looks a lot higher than last year's March. And so is that something that we're seriously still dealing with in our population?
It's not unusual, and now a lot of positive TB results you see, they can be a little misleading. They can be an example of dormant TB, or some TB treatments that were done in the past actually show up in initial testing as a positive result. So that's why they're given a thorough screening. TB treatment is kind of a long process of daily observed therapy, and so, but we do have one of the better TB teams. Like I said, in the region, we get a lot of referrals from other counties. So we're in good hands as far as that goes. Particularly Rutherford County, you see TB a lot in new arrivals to the United States. And so Rutherford County probably sees more of that than surrounding areas. Yes, ma'am.
If no further questions, I'll entertain a motion to approve report.
Motion to approve.
Second.
All in favor say aye. And don't leave yet, Director. Commissioner McMurray, you announced something at the full commission a couple of weeks ago. I'd like to ask if you'd announce again.
Sure. Excuse me. I announced this at our last county commission meeting, but I want to say it again since it's the health and ed. We're very proud of our health department, that the job that you all do on a daily basis. So we commend you for that. But it was brought to our attention that the Rutherford County Health Department was recognized for outstanding service with a regional award. And it says that the Tennessee Department of Health Mid-Cumberland Regional Office has chosen the Rutherford County Department as the Outstanding Health Department of the Year from among the 12 county departments in the region. That to me is a great award, and it shows the hard work that you and your staff are doing. So we want to just congratulate you all this evening and to say thank you. Keep up the great work. As someone who's in healthcare, I appreciate what you do, and if there's anything we can do, just let us know. So hats off to you.
Greatly appreciate that. Yes, sir.
Mr. Chair.
Yes.
We've always had a very good health department throughout the years, but I've never seen a more active health department than I've seen in the last few years. Just everything that the mantra: protect, promote, and improve. and all the events that your department is holding. I've just never seen it. And I think that that's just awesome. Probably why y'all got the award too, I would say.
Thank you, Mr. Commissioner. We do appreciate that. And a big part of that, of course, all credit goes to the hardworking people that work under our roof every day. They get up every day and look for ways to improve the health and well-being of our citizens. But also our community partners. We could not do it alone. So some of those present today, we just appreciate the collaboration that we get and the support we get from this body.
Thank you, Director.
Thank you.
Next, under our Health Department agenda, we have Kristen Swan, who is with us from United Way. And we all met Kristen at her place, gosh, a year or 18 months ago, and just realized just the effort United Way makes for the common good of Rutherford County and how it segues into the Health Department and how that further segues into the Board of Education. So we asked Kristen to come back in a bigger forum to speak to us. And before you do, I just want to acknowledge that Kristen has been promoted to the President and CEO of United Way, Rutherford Cannon County. So congratulations for that. That says a lot for your skills. And if you'll acknowledge Ashley.
Yes, absolutely. So Ashley is going to come up. Ashley Winslow is our director.
Go to the mic, please.
Yes, sorry. Ashley Winslow is our Director of Economic Mobility. I'm going to kind of do my part, and then she's going to come up. I'm going to tell you the problem, and then she's going to tell you the solution. How about that? So, yes, I'm Kristen Swan. I'm the President and CEO of United Way of Rutherford and Cannon Counties. Thank you so much for having us. Really just wanted to share some data that I think could be interesting for you guys where you sit in the community. And like I said, we're going to share some good news about plans that United Way has to hopefully help serve our community even better. So a lot of you guys are familiar with the ALICE data. I think I spoke about that the last time I was here, so I'll just hit on this briefly. But ALICE stands for Asset Limited, Income Constrained, and Employed. And the way I like to talk about this are these are folks in our community that are working, that are still struggling to make ends meet. They're really living paycheck to paycheck, and oftentimes they're one crisis away from really, losing their housing, losing their stability. And so that's a large portion of our community. So in Rutherford County, only 54% of the population is above the ALICE threshold. And I will share with you that where we are sitting right here, 37130, the heart of Murfreesboro, it's even worse, right? So 37% are above the ALICE threshold. So leaving the remaining 64% to be under that threshold. Another thing that United Way looks at, I feel like this is going in and out, is it? Or am I? No? Can you hear me? Okay, all right, cool. Just making sure. So another thing that we look at our metrics, so United Way looks at a lot of community level data, and then we dig into our partners that we fund and also the work that we're doing. But looking at community level data for households that are above the ALICE threshold, we actually are trending up, which is great. That's great news. We want to continue to see that grow. But however, another piece of information that we look at is the percentage of households that pay less than 30% of their income for housing, and we know that that's considered to be cost burden. If a family is paying more than 30% of their monthly income on housing, that's not a good situation for that family. So you can see from 2020 to 2021, that number plummeted, which is not a good thing. Of course, very related to the pandemic, but I would say that we really haven't seen that rebound since then. So another piece of information, another thing that United Way kind of looks at is our unhoused population. So I have spoken to the commission before about our continuum of care, which is all of the agencies in our county that are serving those who are unhoused. You may or may not know that United Way recently took on a larger leadership role with the continuum of care. You might have heard of HARC in the past. So that responsibility has been transitioned to United Way. So we now serve as the collaborative applicant, the coordinated entry lead, and the HMIS lead. And HMIS stands for Homeless Management Information System, which is how we track all of these services in our community. So right now, we have 230 people on the active list. And what that means are these are people who have presented at different agencies that are part of our coordinated entry system to be assessed, and they are currently waiting for a housing solution. So that's two, and we know that's not everybody, but that's how many people who are on the waiting list, if you will. In Rutherford County Schools, and I'll certainly ask Dr. Sullivan if he has anything to add to this, but last school year, they ended at 1,637 students that were identified as homeless according to the McKinney-Vento definition of homelessness. And this year, currently year to date, they've served over 1,800 students in their school system. And that I got the number from Jessica Johnson, so I feel like it's pretty accurate. Anything you want to add to that, Dr. Sullivan? Oh, look at that. Well, that's fair. I literally texted her today, so there you go. One more piece of information, our community does what's called a point-in-time count every year. This is something that HUD requires us to do for our funding, where we have volunteers that go out and count those who are experiencing literal homelessness. So just as a little point of clarification, the McKinney-Vento definition of homelessness is not the same definition that HUD uses. So these are the number of people on a given night in January. Why they choose January, I do not know. That sounds miserable. But at a given night in January, all over the country, people are counting their unhoused population. These are people who are experiencing literal homelessness. They're in a place that's not meant for human habitation. They are outside. This is not someone in a hotel or doubled up or things like that. This is literal homelessness. They also do count people in shelters, homeless shelters. So you can see that number rose from 23 to 24. We counted 400 people this year in Rutherford County alone. And when we look at this information, so kind of segueing from that, when I talked earlier about being the HMIS lead, so the Homeless Management Information System, this is the system that we use to kind of gather information about those who are experiencing homelessness. And this is why it's important, I think, because we can look at a big picture of what that data looks like for our whole community. So between the dates of October 21 and September 30, 22, this is the most recent that I have because this information hasn't been published yet, but this is a report that we send to HUD every year. The average time for someone to be homeless in our community from the time identified to the time that they are, put into some type of housing solution is 70 days. Only 13% of those that are exiting the system, so exiting a shelter, exiting a transitional house, exiting anything, are exiting to a permanent destination, which is not good. And then 3% of those people are exiting the system and then coming back to then be re-identified as homeless within the system. So this doesn't mean that that's everyone that's returning to homelessness, but that's the people that are then re-identified by our agencies here in Rutherford County. Does that make sense? Any questions about that? It's a lot. I know I'm throwing a lot of information at you. So like I said, United Way was recently chosen to be the collaborative applicant for the COC, the coordinated entry lead and the HMIS lead. And we're very proud of that. And I think that, our role in this is really to be a convener. It is not to tell people how to do their jobs or tell them how to run their agencies, but it's really to help us all work better together and to be more efficient. We know there's not enough resources in this community for everyone experiencing homelessness, but if we can have a more coordinated approach, it's going to be better for everyone. And so with that, we currently have 40 people that are trained in coordinated entry. These are the agencies that are currently have been trained on the assessment and are participating. Some more actively than others for different reasons. But if a person in our community is experiencing homelessness and they go to one of these places, they're going to receive the same assessment. They're all using a universal assessment. They're going to be put into our coordinated entry system, and then our coordinated entry manager looks at their assessment score and says, where will they fit best, right? So a mom with 3 kids is not going to be sent to a men's shelter. So they really look at, it's almost like triage, if you think about triage at a hospital. So she kind of looks at who has availability, where can they go, what best fits their needs. This really helps cut down on folks having to go from place to place. I know at the United Way office we get calls all the time for people that are looking for assistance, and I can guarantee you they've already called 12 other places. So the more and more and more that we do this as a community, folks will begin to understand, I've already been been to the Salvation Army and I filled out the assessment, I don't have to go to all these other places. I'm on the list. So I think that's important, and I think it will really help our agencies that are already, they're already overworked and overwhelmed, and the people looking for help are overwhelmed. And so being able to cut down on, some of that going to a million different places will really help. One last thing I will say before Ashley comes up to talk about some plans that United Way has. We are in kind of the infancy of using 211 as kind of a first call for help. So I know my friend Byron is a huge 211 fan. He tells people at the health department all the time. Our hope is that eventually if someone doesn't know where to go, they don't know about Salvation Army, they don't know about Journey Home, they don't know about Nourish Food Bank, that if they call 211 and say, I'm experiencing homelessness, that 211 can give them one of these places that they can go get assessed. And so just one more way that we can kind of streamline and make that more accessible to more people in our community. Any questions for me before Ashley comes and gives us some good news? I'm the bearer of bad news. She's gonna.
I just did have, so
Sure.
Are there uncounted homeless? There's a January count.
Yes.
And then there's those who have submitted in some way to your continuum of care. Do you have any guesstimate on the uncounted percentage or number?
No, I really, I don't want to make up a number, and so the McKinney-Vento number, and this is just for y'all's education purposes. The McKinney-Vento, their definition of homelessness is a little bit different. So they're counting folks that are students that they're doubled up. Maybe they're living in a hotel or motel, somewhere that's not permanent. That's kind of more of that broad definition. When we talk about the continuum of care, they're using HUD's definition of homelessness. And so you have the PIT count every year, which is kind of like a census, if you will, of those who are experiencing literal homelessness. And then we have those who are identified through the system. I certainly believe there are more that have not been identified, but I would have absolutely no way to guess. So I wish I did.
Any questions?
Yep.
For yes, Commissioner Oliver.
Question. And
Yes,
so when they take that count in January every year,
Yes, ma'am.
what do they do with that number? What is that?
We report it to HUD.
And then what happens after that? I'm just saying, what do they do with that actual literal number?
So that number is reported to HUD on a federal level. It does in some way dictate the funding that we receive from HUD, because they're looking at how many people, so it matters, it really means something for us to do that count. From there, though, I mean, that's the way we use it, if you will. And it's also, I think, just it's done at the same time every year. So it is the best way that we can get that number. And I will say, I know you're from Laverne, correct? So we do have people that go count in Smyrna and go count in Laverne. So we do cover the entire county when we do that count and when I say we, Murfreesboro Coal Patrol is heavily involved with that. A lot of our partner agencies, it's not me counting and out, so it's a community effort to get that count every year.
And because you collaborate with other agencies, do you all report that? Do you all have to go in and report that number, or is it a collaborative and it's just reported once?
It's reported once. The
okay.
point in time count is reported. It's a community effort.
Okay.
Anyone that wants to volunteer to do it, they go out at the same time. It's a 24-hour period, but it's the same every year. And then that's reported up through HUD. Yeah. Yes, ma'am.
So I was looking at the list of people in your 40 agencies, and I didn't see anyone from Laverne on there. Is there anyone in Laverne that works with you?
That's a great
like we need to
question.
push.
Yeah, I know Operation Stand Down does have a more regional approach. The U.S. Department of Veterans Affairs is more of a regional partner. Nourish Food Bank is in Murfreesboro and Smyrna. I'm trying to think. A lot of these are, the Town of Smyrna Police Department is one of our partners. I don't know that there are any that are specific to Laverne. We would love to have a Laverne partner if you have ideas.
Just thinking
Yeah.
that, then I'll be passing that along when
Yeah.
I leave here.
Yeah, absolutely.
Because I know currently we have homeless people. Some of them are living in tents off of the Greenway, but we actually have one person that is living in front of the Dollar General, and she feels safe there. No one wants to physically remove her, but I would like to get her some help. You're living in the elements in front of a store.
Right.
And that's why I was like, I don't see Laverne on there. Wait a minute.
Yeah, I will say the city of Laverne has had representation on the board of the Continuum of Care in the past. I'm not sure if they currently still do, so we would love your support in making that connection. Absolutely. Yes, absolutely. Yes, ma'am. Any other questions?
Well,
Okay.
before you leave, I just like, this is more of a comment for you guys. I want to say you're doing a great job. Once a month I go and volunteer to serve the homeless at the Journey Home, and there's been a few times where I just listen to those individuals, because a lot of times they want to just if you just listen to them and not bash them, and I'll try to educate the public on doing that, because like you said, sometimes we may be a paycheck or two away from being in that same position, but they have mentioned the United Way as someone helping them. And I want to say thank you guys for what you're doing, because it's making a difference. And so the 211 and you all are doing a great job, so keep it up. We'll try to do whatever we can. But before you walk away, I know government usually tells agencies or whatever what to do. But my question to you is, what can we do to help you guys out?
Absolutely. I mean, I feel like the number one answer that everyone tells you is funding, and I'm going to throw that out there. Ashley is going to talk about some things that we have planned, and you hit on something, Commissioner McMurray, that I think is so key. So one of the things too, I think, is education, right? Because when we talk about this ALICE population, that's almost 50% of the people living in Rutherford County. We have this image in our mind of what the homeless population looks like, what those who are experiencing homelessness look like, and oftentimes that's not the majority of what we see. In Ashley's, program, she's over several programs at United Way, but the things that we're seeing are people that are working, that something has happened. Perhaps they don't have a lot of options and they've gotten into a payday loan situation that they can't get out of. And so we see much, 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 much more of that than we do of chronic homelessness. And so I think that's where, providing education for people that may not completely understand what that looks like is so critical. And really just understanding that there is a gap in services. As much as we don't have enough services for those who are literally homeless, we have even fewer services for those who are working but are still unable to make the true cost of living. Maybe they make a little bit too much to qualify for benefits, but they're still not making, and Ashley's going to talk to you a little bit about the benefits cliff and what that looks like in our community. So I'll give you the obvious answer, which is always funding for some programs that could help with that population, because in our work, and I would say United Way has a pretty good bird's eye view of the nonprofit community as far as what's happening, what resources are available, and this is truly a gap in services, is how are we helping working families that just aren't able to make it. So thank you for asking that question. I really appreciate that. Any other questions before I turn it over to Ashley? Okay, awesome. Well, Ashley Wenzel is our Director of Economic Mobility. She oversees our VITA Volunteer Income Tax Assistance Program, and she also oversees our Launch Point initiative, and she's going to tell you a little bit more about that and some exciting plans that we have. So, yeah.
Thank you for having me. Can you hear me? I'm shorter, so I have to bring it down. My name is Ashley Wenzel. I'm the Director of Economic Mobility. Like Kristen said, I'm a clinical therapist by trade. And basically what economic mobility means is I oversee all of our programs that help with financial stability. Like she said, is VITA, which is our free tax support for families and individuals, our Launch Point, which is already helping families that are in that gap between the ALICE and poverty lines, and we're going to talk a little bit more about that. Today we're going to talk about the awareness of why a financial empowerment center, which is our goal to open here in Murfreesboro, is important to our area. The aim is, what is our goal for that? How are we going to get there? What makes this partnership critical and different, which I think is one of the most important things, and I actually talk about that all the time at United Way and with one of our friends here on the commission board. And achievement, to answer Romel's question on how you can help us achieve this. So awareness, and I won't go too in-depth because Kristen shared the problem with us. I'm going to share the solution. But I am going to talk about a few graphs that she did not go over because I think they're really important for people to understand when we're talking about families that are in those ALICE gaps. There's no sustained change without sustained relationships. So a lot of our families are receiving resources, right? We're giving them out left and right, but they don't know how to put that information together. They don't know what to do with that to actually become financially stable and grow in those financial areas. So what we're missing, there's an absence of financial coaching and case management for these folks that are in the ALICE scores. And also what's really cool about the Financial Empowerment Center, and we'll talk more about this, is we will work with financial empowerment for cities, and we can actually serve families. There are no qualifications for income. So we're going to serve those families that are in the poverty demographics, in the ALICE demographics, and those that are even closer near those ALICE demographics and above, which it sets this Financial Empowerment Center apart from other programs. The lack of this awareness, which Kristen touched on, is leaving a lot of our families in the service gaps. She went over the ALICE information that's in that top graph that I know you can all see very well there. That second graph that you also probably can't see, what's really important to know about that one, that's a benefit cliff. A lot of people have this misconception about families that are in poverty or in ALICE. Why don't they just get a better job? Well, for some of those moms or some of those families, that means that making just $50 more an hour, you lose $800 worth of benefits that you're getting from the state. So a lot of people don't understand that information, and that's what that second graph shows, is that the more income they make, which obviously making $50 more and losing $800 of SNAP benefits, child care benefits, does not help someone. So how do we fix that? We get people to get financially stable. We help them with resources, but then we also connect them with that financial coaching. And I just jumped ahead. So the absence of that support is leaving a lot of our families in the gaps. The huge direct impact, there's also what we've learned in our community, which is really neat because I'll explain how we're going to create a hub. We're looking at more than just the Financial Economic Center. We're looking at it as a hub for places for people to go where they can get all the services all in one stop. And we'll talk about some of that with our Launch Point program and programs that we plan to embed there. But there is a huge direct impact with these things that we're talking about with benefit cliffs with our skilled labor force, which has also been a big push for the community. So a lot of these people that are making $13 an hour and we think, why don't they just get a better job? Like I talked about, then they're making $19, $20 an hour, but they don't know how to manage that. So having that financial planning, having those financial counselors and case managers help them build savings, credit, and learn how can we budget to still be able to make more income, get these jobs, and still sustain the things that we need from the resources in the community. Another big issue is that more than 65 million adults in the United States don't have a checking or banking account. Part of the FEC is helping families just get a bank account, simple things like that, getting them into our community and getting them a banking account, checking account, and learning how to manage that because a lot of them don't even know how to do that. 55% of households do not have a savings to replace a month of their income. So this is the big one. This is what Kristen was talking about, where we have more than, I think it was 38%, Rutherford County, 46% just right here. Of families that are a paycheck away from homelessness or some crisis. A lot of people will ask me, we have the Maslow's hierarchy of needs. A lot of people will ask me, why are you so interested and passionate about financial and economic mobility when you're a clinical therapist? And I will tell you, before I moved here, I ran a community impact program for the Chicago Police Department and the Kane County Sheriff's Office. And as a therapist, I learned, and I especially identify this in the community as I've been an executive director at some of our large nonprofits here, that you can't really get to their health and their emotional wellness and things like that until they're getting their baseline safety needs and their financial needs, their security needs. And so I'm super passionate about that and also about accountability, which we'll get to as well. So what is the aim? To provide all individuals and families in our community with financial guidance for sustainable economic growth. by tapping into the strengths, like Kristen talked about, gathering all the different places and having it in one hub, one place where the families that either need Launch Point or VITA services, social services, case management, trying to find where they need to go for the night, anything like that, they're in one place. I always tell people, imagine a single mom who doesn't have a car that works. She comes in, she needs something, and then she gets one thing from here, shampoo, and then she's got to drive 20 minutes away to one of our nonprofits that says they provide something, but they actually don't, or they're closed. This is a central area where we can help them get all the resources that they need, including the skilled labor connections. The other big aim is that, and we'll talk about this when we talk about what makes this partnership so much different, is that we will be giving the outcomes directly to the city, and I'll show you the model of what an FEC, a true FEC, looks like. So our action is to join 112 other cities throughout the United States with the Financial Empowerment Center, attain partnership with local government, and apply for a Financial Empowerment Center planning grant. Mayor McFarland is already interested in, if we met with the Development Committee. There does have to be a government entity that oversees it, and so right now we're hoping that that will be Murfreesboro City. They really wanted to know that we had county buy-in as well. And why? And that's important to us, because if someone comes in from Murfreesboro, but they're on that outskirts, right, on that farm where they're not really in the city, they're in the county, we want to be able to still serve them. So we do have to have county partnership and able to do that. So that's one need, Romel. We will then apply for the 2-year grant and raise funds from the community partners and different community folks to open and launch our FEC. Our plan is to either have our own facility for the Financial Empowerment Center or embed it into another agency or organization that already exists. We have talked to TCAT about potentially using their space. We're in the very beginning stages of doing that, but that would just be a very good collaborative partner, as they're strongly connected and correlated with this issue. And the real idea is to see real and lasting change and upward economic mobility for our residents. So this is what the model looks like for an FEC. So Cities for Financial Empowerment Center is a large nonprofit that serves the United States. They help us they have an academy that we would go through and teach us how to do that, how they've done it with the other 112 cities that they have. I know to date, as of yesterday, they have spent over $6.6 million to families and individuals to get them to that space of economic mobility in an upward fashion, and that they're currently serving 900,000 families. The city model, like I said, it does have to be administrated by the city. It can be county as well. Typically, the model is city with county buy-in, because again, we want to be able to serve all the folks in that area. So the city's responsibility is to administrate, help with funding, support that role. They have to actually have a city manager position that will oversee what happens. And then the United Way would be the partner, and we do all of the hiring for financial coaches and for all of the case managers, or oversee any of the other services that we embed to the FEC. What makes this model really important is that it's outcome driven. We will be reporting, instead of all these large nonprofits or these different places that are getting all sorts of funding, but we're not always able to tell what is going on, this will bring that all together. We will be able to report directly to the city. This is the amount of funding that we're getting, and this is the return of investment to our city and to our county residents, which is probably the most important. So what we need from you is to help us make this possible, whether that is just funding or talking about this, getting people to buy in about why this is important, talking about the families and the folks that are in those gaps, because above 54% people in Alice is very scary. And so it's obvious that our community needs this. So, and help us be the 113th city to house a Financial Empowerment Center and separate us from other counties. Thank you very much. Any questions? Awesome. Thank you so much for having me.
I thought I saw some microphone reaches, but I guess not. So thank you. A lot to take in. And this information, the PowerPoint, how can we make that available to our IT folks or yeah. Yes.
Okay.
Yes, you know,
I'll get this
talk
out.
addresses.
Yes, absolutely. And we're happy to, if there's any, if you kind of stew on this and think about this, this is something that's kind of in our strategic plan to get going for our community. I will tell you that Mayor Reed in Smyrna is supportive of this as well. And so like Ashley said, the more support that we have, because we want this to be available for everyone in Rutherford County. While the national model is to have, a city, it's a city nonprofit partnership, which I think is so great. But just having that buy-in. So if you guys, we'll send this out. If you sleep on it and have a million questions, I'm sure Ashley would love to answer those. And we could have a smaller session or something like that. We just wanted to bring this to your attention because sometimes we get tired of just talking about the problem, right? Yes, ma'am.
I do have a question. Since the TCAT relationship is a possibility,
Yes.
should that move forward, could this program possibly be in more than one location?
Yes. So there is a model in West Tennessee that we have researched a lot. So the United Way of West Tennessee and the City of Jackson have this partnership. They've been doing it for about 3 years. But the United Way of West Tennessee covers 14 counties. And so they have satellite locations. So they have the main relationship and then they have different. And I think it would be super important and imperative that we have locations physically in Smyrna, Laverne, if there are other rural, because I think some of it is done virtually, the counseling, but like Ashley said, having a place where people can go for services is very important. So we are very cognizant that we would not want this to just be Murfreesboro centric. So. Awesome.
So I will say, I got one last comment.
I don't know if Ashley, but go ahead.
No, you need to go ahead.
No, you're good.
Okay.
Go ahead.
I was going to say, no, I've dived into this already, and I'm very excited about what's to come. I'm excited that hopefully, Murfreesboro, Smyrna, Laverne, everyone gets involved, and we can partner to help them out as well. So I encourage everyone to dive into this. Let's get behind these ladies. Again, they're doing a phenomenal job at the United Way, and so many people have said that already, and I've seen it, and so I think they're going to try to help us, take us forward, and move us in a great way that we should. So I appreciate you ladies for what you're doing. So keep up the great job. Just let us know what we need to do for you.
Thank you so much.
Thanks, Commissioner. And thank you, Kristen. And I know one way, I think at the end of the budget year, the final pages of the budget handbook are contributions to nonprofits. And I think United Way has been in that list, and let's continue to look for them in that list. I don't know if there's any Atlas component to this. I think we covered some numbers, and so I won't, if nobody asks, we'll just move on from that. Commissioner Wilson.
Yeah, just a quick comment. I wanted to thank the chairman for having this conversation. I think a lot of us have been recently seeing some of the population increase estimates that we're seeing, between now and next year and even 5 and 10 years. I really believe that this subject of financially empowering people to take care of themselves, I believe the cost of not doing something like this would be greater to our county than it would be right at the cusp of explosion of population, thinking about what we can do to help people help themselves. So I hope that we will continue this conversation, because again, I just want to repeat, I think the cost of not thinking forward on how we help people take care of themselves would actually cost us more in the future. So I thank the chairman for your comments that health and education, they are continuing to combine. Just the conversation with the Atlas program, the same folks that are having issues that are part of the Atlas program are also children that are in our Atlas program. We're not dealing with two groups or two things. We're dealing with a community that is struggling. And one thing Kristen pointed out in the report, we all know, but you see the graphs, is as your salary increases go up and your wages go up, if inflation goes up and your housing costs go up, your net is 0 or less than. So that's what people are struggling with. So I thank the chairman for continuing this conversation because I think we have to find ways to partner both with the municipalities and conversations with the county on really getting in front of this problem before it becomes something that we're all saddened by, which is an increasing homeless population and a no real plan to help. So thank you for that, and to this commission for continuing to get in front of this. Thank you. I think it's the most important work we're going to do is preparing for our future.
Thank you, Vice Chair. Thanks for your contribution to the agenda. Next on our agenda is the community care. I would encourage you to look at their minutes. They were published. One item I did notice in the minutes that during our last Health and Ed meeting, we realized that the new wing had not been opened because of some state code inspections, and I did notice that the plans have been accepted by the state, the codes have been met, and an inspection is either complete or underway. So just FYI, just an update on that. Special projects, we have no report. We know that we moved some funds last month to cover, or month before actually, to cover some upcoming expenditures. And I'm sure Michael will have an update on that in months to come. The last item that we have, item number 7, is a conversation with Dr. Sullivan and Dr. Martin if she wishes to participate on school construction. And the motive for this is that we're launching into the budget season. We know that the school board has prepared us to anticipate new schools on the horizon. We're also hearing in the media, and we're this new occasion of charter schools in Rutherford County, and we're hearing the charter schools can build buildings in a certain way, or the charter schools may or may not have conditions placed on them that affect the cost of their schools. So we wanted to have some conversations to help us understand the difference as we prepare for receiving a request from the schools for funds. The charter school that we had on tonight cannot make it. We'll consider them next month in our joint meeting. It might be good for the budget committee to also hear from them. So tonight we have Dr. Sullivan has agreed to talk about, the question we posed to him was, what's your decision-making process in building schools? How do you think about your specifications and design? So that's a topic, and I think Dr. Sullivan also had some updates on enrollment. If you want to do those first and then jump in.
Yep, so I hit on enrollment first. I gave you all a little bit different version, so we do this about once or twice a year. A different version of what our enrollment report looks like. This way you can see by grade level, also by demographic enrollment. The total, the one that you really want to look at, is at the very back page, and it is the total number, which is 51,827. And this is as of today. So this was run this morning through April 23rd. It's 51,827. That does include pre-K, and so you've got about 900 pre-K students that are in that. Some of those we're required to serve special education. Some of them, it's through a state voluntary pre-K program from 51,827. Does. Because this is Health and Ed, something else about enrollment I want to bring to your attention, and I should have mentioned it to you, Commissioner Wilson and Dodd, if I didn't last week. We, as you guys are aware of, earlier this year at Stewart's Creek Elementary, we paused enrollment. Capped enrollment was the word we used. We capped enrollment at Stewart's Creek Elementary School, and instead those students went to Stewartsboro, anybody that moved in. We have now used up all of our space at Stewartsboro. And so anybody that enrolls next year at Stewart's Creek Elementary will instead be transported to Browns Chapel. So that's a little bit of a different change, but Stewartsboro, you will see on this, is a huge beginning of the school year. Yes, sir. And if they have a sibling, we're going to let the sibling go to whatever school the other one's already at. So if they already have one at Stewartsboro, they'll stay at Stewartsboro. But new students we're going to enroll next year that are not in kindergarten at Stewart's Creek Elementary are going to go to Browns Chapel until we get the new elementary school built. So I know that impacts several of you all. We had some conversations with real estate agents, realtors, and home builders, so just want to put that on your radar. I guess officially the board must approve that on May 9th, but we put that in our motion originally.
How does that impact the rezoning that you already have planned?
It doesn't, because this is just for next year. The rezoning for that area doesn't go into effect until the new elementary school opens. And so we had this in our
So
original.
the rezoning that's going in effect this year is not going to impact Browns Chapel?
It won't impact that area. No, ma'am. So that's a little bit of our enrollment. So Stewartsboro, just to kind of look at them, and they're by number. I know that can be a little bit hard. They're not in alphabetical order. They're in state numbers. So Stewartsboro is at 912. They were just above 750 when we started this. So they've added about 150 students that if we did not cap enrollment, then those students would all be at Stewarts Creek Elementary, and we'd have about 1,500 for a building of 1,000 to 1,100. So wasn't fun, wasn't popular, but it needed to happen. Take any questions on enrollment, if y'all are interested.
Yeah, let's carry on to the next topic.
Next topic, so I can give you a couple budget overview items. Do you want me to do budget first or building specs first? Which one do you want to discuss first? Budget? Okay. We are right in the middle of our budget process, actually pretty far along with it. So our overall is going to be looking at a 2.5% raise to our table. So that is just across the board 2.5%. We're calling it a cost of a living adjustment, so a COLA, a 2.5% raise to the table. I believe that's probably going to be below what the county is requesting, but for our teachers and staff, we're doing 2.5%. They do have an additional raise that ranges from 0.5 to 1.6, depending on whatever year of experience they're in. One of the issues we're trying to cover this year is ESSER money runs out this year. So that ends on June 30th. So we are rolling those positions. We're very strategic and have rolled those positions over the last 3 years into the budget. So it's not a huge thing. Growth positions, we are looking somewhere between 60 and 80. I'll have that final number of growth teaching positions at the end of this week because we haven't presented that to our board yet. We're still in our final conversations with that. The largest majority of our growth positions are English as a second language. And so those are huge growth positions. When this was due in January from our department heads, it was a request of 25, and I know we have to add an additional 8 to that already for new English as a second language students we've received from January until right now. The offsetting part of that is that if English as a second language students test out, they took their test, their WIDA test is what we call it in February, we will have some students who test out, and so we hope that enough students test out that we can limit some of those position needs. So that's kind of the counterbalance you never truly know. One of the other big
question
yes,
about the testing out. What
Yep.
strategies are you putting in place to possibly assist the students to ensure that that happens?
Right. A little bit of everything. And so everything is in their tiers. And so for their tiers, they have to score above a 4.5 on literacy and on overall reading comprehension. Your students who are in Tier A are new to English, and it's going to take them several years to be able to do that, so they don't even actually take the test to allow them to test out because it would be too stressful. We have with Elevation, which is our data center that we use for all of our English as a second language student scores, we track to see where they were to be able to make sure we offset areas that they were weak in. One of the areas that students struggle with the most actually is their speaking one. And because teachers may feel like the student is doing great, they're not being disruptive in class, but they don't get that opportunity to speak. And on WIDA, they have to actually speak into a microphone. It looks at their dictation to make sure that they can communicate effectively with the English language. So that's one of the areas we target the most. A couple years ago in instruction, we purchased microphones, computers, the computer programs, all that to be able to give them extra practice. So, great question.
And what is the status? I know at one point you were having challenges filling those teaching positions in that area, so that's a resource as well. So again,
they're all filled right now.
Okay.
Except
Great.
we added some new ones. The new ones aren't filled in interims, maternity leave, but overall we are in great shape. And I hate to even say that out loud from a staffing standpoint, compared to most places especially. Yeah. We had maybe the end of February, we had a report for our quarterly report for our school board, and we had 21 certified openings at that time out of 3,600 certified teachers, so doing very well. The Next part is looking at our budget, and so we talked about this in Health and Ed 2 months ago. What we are still a little bit concerned about is our charter school operations, and so to discuss that a little bit further, I know that Rutherford Collegiate Prep was potentially going to be on the agenda for tonight, and they may be on the agenda for the next one. That is not a Rutherford County school, and so they will not impact our funding. That funding goes strictly as a pass-through from the state to Rutherford Collegiate Prep. The other two charter schools, Springs and American Classical Rutherford, will actually go through us, and so we have to pay those schools up front for their projected enrollment. We discussed this at Health and Ed last time. We are going to have I hate to say we're going to have a balanced budget, but the deficit coming out of fund balance is going to be the money that we have to budget up front to send to the charter schools. We will have that money sent back to us the following year, but it is a year behind. And so that's just a conversation that we're talking about. We plan on balancing our budget, with the only portion not being balanced is the deficit to fund the charter schools. I tried every way I could to make it so that we could balance it overall, but that would have been taking a percentage raise away from our staff, and I didn't feel like that was fair to take a percentage raise away for something that was completely out of their control of how charter schools are funded. And so that's something we've talked about exclusively kind of with the board. As part of that budget being balanced, did Michael Smith and several of us have had conversations to give you an idea of where we're looking at for requests for buildings. We plan to request the Laverne High School addition between July and September. I'm hoping more July, August. We have a school board election, a general election that is upcoming in September, and I would like to try to get that portion done while we have our current school board, just so that you have that commonality of understanding of what we've been working with instead of starting over. Regardless of who our board members are, we'll work with them and bring up to speed, but that's just an easier thing to go ahead and do. The other request, and I know that this is the funding issue, is the middle school on the Beatty property. So that is going to be a request during this fiscal year. That is somewhere between 80 and 100 million, depending on what the overall cost per square foot. It's stabilized some, which we hope to see it continually stabilize. I know Michael has talked to the commission about, they did a 10-year loan instead of a 20-year loan for the elementary school, so that brought it back a little bit of borrowing capacity. I still don't think there's enough there for the middle school, but that's going to be one of our requests, and our overall middle school zoning depends on that middle school being open. Or the next conversation that we have is, if that is not approved, and I respect the position you guys are in, then we'll have to come back and just ask for portables. Dozens of portables to go at Blackman Middle and Rockville Middle. Blackman Middle, I think on this report, is $1,670, and Rockville Middle is at about $1,550. They are going to be Blackman Middle way over $2,000 before long. And so we either have to have a school or make an additional portable area out there. It just won't hold. So that's just kind of an overview of the budget. We have worked on 177, we've worked on 143, 141. We are still putting together again. And then our target date, we have to have those to Michael and the County Commission by May 15th. I hope to have them there by May 10th. Our board has a meeting on May 9th. That is our hopeful date, but I have a tentative special called meeting scheduled for May 14th, just in case we have to have another meeting.
Just one quick question on your staff raises. What percentage of that, or how close are we getting to that new state mandate of the
Glad you brought that up.
50,000 minimum? Just how much of that is part of it, which is somewhere we have to go, we have no choice?
It absolutely is. So next year, and looking at our budget, I think the county's in the same area, we need to get to 50,000 by the 26-27 school year. This will get us to 48. I'll pull it up in just a second and tell you exactly where it is. We need to do 2.5 this year, 2 next year, and then 2 the following year to get to 50,000. And it gets to 50,000 by about $200. There's not a lot of room to spare, but we make it to 50,000. So glad you brought that up. The question that even some of our board members have asked has been, TISA is getting a bump. It's getting a 3% bump in the per student allotment. So what do you do with those TISA funds? Those TISA funds are basically put in place to educate the kids that we've gained this year that we're not funded on until next year. And so we are always a year behind. It is very frustrating to budget that way, especially when TISA was sold to us as the money's going to follow the child. And it does follow the child. It follows the child the next year, just like BEP did. And so all of the students we have added this school year, we're adding growth positions to fund the kids we added this year. And so next year's budget will fund the kids we added this school year. And so we're always a year behind. But overall, to be able to balance the budget 2 years in a row, we're very happy with. And so those are things that we're thrilled with.
I know a couple numbers that would just be good to hear for everyone would be, obviously, mandated pay increases.
Correct.
We have to get there, so we need to see what those are so we know what our path is. The other one is mandates on ratios on your English second languages. You know, are some of those growth positions, are we going to, or do we have to do them because we have to meet a state
Absolutely.
ratio? There's a difference in what we have to do to meet a state requirement and then what we want to do. I just want to be sure, since things are getting so expensive,
Yep.
I think the clearer we are on what we have to do, we're mandated to do versus wants, it would be very important so that we know what we must do first and then
Absolutely.
look at the rest. If I can just,
Yes. All of our positions are allocated to principals, so we start in January meeting with principals, and we go up until April, and then we take positions away in August, truly to meet the state maximum. So we've had questions about how can you lower the teacher-student ratio. I'd love to lower the teacher-student ratio, but we budget to 1 to 20 kids in K through 3. Your special education, ESL can lower that a little bit, but we don't allocate positions until a school meets that threshold.
Just another point, I think that the school board has been able to do some raises across the board last year and balance the budget.
Yep.
And I think that helped fill the positions that Commissioner Oliver was acknowledging, that
It did.
it's one of the better low vacancy positions that I've seen in my years up here. So it takes inducing the teachers to come and to stay. Part of it.
You guys will see 2 amendments, probably one in May and one in June. May, we just received our summer school allocation. Our summer school allocation is a little bit over $4 million, so you'll see that amendment. You'll see our huge end-of-the-year cleanup amendment. So we've said from the beginning our budget will be balanced. We should be able to put a couple million back into fund balance, and so that's always a positive as well, especially since I know there were questions this year about, did you budget over, did you under budget? We should be able to put several million back into fund balance again this year. So that's good. We've got about 10 million more that we can add from TISA to cover some of that. So overall, very positive. I know we always talk doom and gloom because of growth, but overall, things are going really well.
I have a few quick questions. One, in regards to the 2%, is it just for teachers and
No, it's all
staff, or is it
staff.
all the entire,
All staff.
including central office, everybody?
Yes.
Okay.
Yep. And I'm glad you brought that up. Classified staff will actually get the biggest raise in most, and so your EAs, your cafeteria monitors, on our salary schedule last year, it was built in. Every year of experience is a 1.6% increase. So your EAs, your custodians will get a 2.5%, and if they were with us this year, plus 1.6. So it's really about 4.1. Teachers and central office staff, depending on their year of experience, it goes anywhere from 0.25 to 3.5. I can't remember. Each year is a little bit different.
All right. My next question, in regards to like the Beatty school property, and I'm sure we probably are we working with the county and city on that infrastructure?
Ooh, boy.
Because 7 o'clock this morning, it was already a mess. And the school
yep.
is not even in the, I'm just wondering if it's going to be widened or whatnot, because I'm getting a lot of phone calls from constituents over in the Shelton Square area and all that good stuff.
We're working with the city. The city's asking a lot of questions. There's the school board is going to improve an intersection at Blackman and Baker Road, and as part of this package, and the city's looking at improvements at, I'm calling the 4-way stop, the Blackman, Burnt Knob, Baker, Manson Pike, excuse me, that intersection. But we're in negotiations now to can we collaborate on that?
Great
Okay.
way.
Perfect, thank you. And one last question, sorry, I just got questions all
No,
night
it's good.
tonight.
And the only thing I would add is, so our school system is talked about. If you want to go back and look at our school board work session from last Tuesday night, we discussed it in a little bit more detail. Schools don't necessarily, our school system doesn't build roads, and so I know that gets into the conversation between the city and the county. We've worked with Greg Brooks extensively, but you always have disagreement about what needs to be done. And so I think we all agree, and so I don't want to speak for Commissioner Dodd, but things need to be improved in that. It is a growing area, part in the city, part in the county that a school is going to go on.
Gotcha.
I'm very concerned that eventually the school system gets blamed for that, and that trying to protect the school system. Going,
I'm defending you guys
Yeah, we
already,
didn't build the apartments and everything, guys. We didn't put them there.
Got you. And my last question, I brought this up in last month's Public Safety Committee in regards to school resource officers. Now, I know like Blackman is the largest. Have you all, or are you planning on requesting to maybe at some of these larger middle and elementary schools an additional school resource officer? Because I feel like just one school resource officer at Blackman Middle School,
Yep.
it's a lot for what, 15, 16, 1,700 students
is.
for one officer. So that's my question.
So Blackman Middle School will be one of our requests. I know that Patty Easter, our school safety director, has talked to Barry Hendrickson, Captain Hendrickson, a lot about that as quite a bit. Yep.
Thank you, Superintendent. I think we can move on to the school construction topic if you're ready.
So several questions. Yeah.
The construction phase. Next month is our annual budget meeting that coincides with our budget committee.
Correct.
Usually pass out spreadsheets that deal with prior budgets, current budgets, and proposed budgets. How soon could you get those into our hands, not only this committee's, but the budget committee's hands, before that meeting?
As soon as the board passes it, probably within 48 hours.
Did
So the
you
board
say a
should
moment ago,
May 9th is when the board should pass it. If something happens and we have to add a special call on May 14th, May 14th would be our special called meeting, and within 48 hours, I can have that. Within
I'm
2
sorry, we
weeks.
should have that spreadsheet a
Least-
couple of weeks before
Yep.
that meeting?
Correct.
So we'll be able to delve into that? and
Correct.
Be
We'd be
able
happy to meet with anybody and show anybody anything. Commissioner Dodd last year had to come and see every teacher that was added, how we take every teacher, their individual salary, and add them all up to come up with our number. So be happy to. All right, so looking at construction, there's been some conversation around in the requests, how do you guys determine what your needs are as a school versus there's also some conversation around how could you potentially build it cheaper with some pre-engineered steel buildings, which you see a lot of nonprofits and a lot of schools that are going to be added to churches. That's usually the quick way to get them started. And so our building structure is we're looking at concrete masonry units, and that is what we have built for as long as I can think of. The brick blocks, the brick walls, having drywall as little as possible for several different reasons. So we had our engineers work through this because I just asked them, the engineers we contract with, and then our internal staff as well. It's just give us some bullet points about kind of what are the pros and cons for how we build schools. Ultimately, it comes down to longevity and then just the use of the facility for our community. So to give you a great example, your pre-engineered steel buildings are going to look for use of about 20 years. And does it come in at a cheaper square footage? Yes, but that also comes in with, after 20 years, you need to do renovation or rebuild or do something. Siegel High School is in year 21 this year. And Siegel High School, the only thing it needs, and I hate to even bring this topic up, but here I go, the only thing it's going to need is going to need a roof at some point. And so that is the only thing Siegel High School. We've done maintenance to keep the building where it needs to be able to replace the floors. That's what Siegel High School is needed. For a charter school, it is very advantageous to build a pre-manufactured steel building for a couple reasons. One, your cost is lower, but second, your contract is only guaranteed with a authorizer for 10 years. And so you wouldn't want to go and build a building for 100 years if your contract may be gone after 10. And so I totally understand the avenue they're coming from. For us, our buildings, we're building them hopefully to be able to last, I put 50 on here, but we're really looking closer to 50 to 100 years is what our buildings are for. And then the other aspect of that is our codes. And when we are having our huge classrooms or our huge buildings, we use our gymnasiums as a storm shelter area as well. You can make that argument to make some of your gymnasiums, your auditoriums, your cafeterias, use that portion as kind of that frame and then just use your hallway space as your concrete. That's not an area that, because our schools are so large, we've got to use our gymnasiums and those different types of things for storm shelter. I don't like it, but that's what we have to do, and it makes them overall safe and makes them last longer. So just gave you some overall bullets. This is not my area of expertise, but it is something I know gets a lot of conversation. So just want to give you some overall bullets of kind of what we felt like was the benefit versus the downside to having those pre-manufactured, pre-engineered steel buildings. It definitely has a need. It's not necessarily the need that we have as a county school system that will still be here in 50 years.
So the charter school out at Banson Pike is a noble initiative, I believe. Is that the right?
Correct.
So, there's this, anybody seen it? It's a concrete slab poured on grade and tilted up. It's just kind of interesting. I have no idea what that is per square foot. But just, there is one you can go see if you're ever out that way. I may have to wait for these questions till we have the charter school here, but do you know if they have the same codes, mandates, specs? Is there any spec on a public school that
I have
school
no
may or
clue.
may not have? Okay.
No clue.
Unfair question.
Not a bad question. I just have no idea.
Yeah.
No idea.
One question I hear often and is one story versus two story, and I've heard it go back and forth. Where's y'all's philosophy? How did you go on stacking?
Right.
Kind of how'd you get there? And
So our philosophy right now with the price of land is to go up. So that is our philosophy at this moment. That philosophy has kind of changed over time. The only downside to that is we have an elementary school already two-story design, and so we can continue to repurpose that design. It saves us about 1.5% on our architect fee by repurposing that design, and so saves us about $1 million. When we go to the new middle school, we do not already have a two-story middle school design. We are building the same design that we opened the first year of Stewart's Creek Middle in 2006. So it is a 18-year design, and so that saves us, but we do need to go up at the Beatty property for a middle school, so we will have an extra 1.5% increase because we plan on going to 2 stories. Eventually, I would imagine a 3 stories is probably going to be more likely for a middle school that you build 6th grade on 1 floor, 7th and 8th. I think those days are coming as well. So it used to be build 1 story because you could get it done quicker, and now it really doesn't matter. So you do add that cost per square foot goes up just a little bit when you add in the extra stairwell cost, but it offsets with some of your other costs as well.
I think, again, I'm picking on Noble because I'm seeing that campus get built. It looks like it's a building and a retention pond and parking lots. And the parking lots don't look nearly large enough. So I'm sure it is because the county and city do very stringent counts. Having said that, do y'all have either a mandate or is it the philosophy of the school board to have extracurricular activities built into your budgets up front?
Absolutely,
Minimum
yes.
of football or baseball, softball.
And these school applications do have that in their budget. So in their application, where they're going, I do not know. But it was in their initial applications.
The one out on Veterans that came through Public Works had future ball fields. Okay.
Yeah. That's the other part that I think is interesting is that charter school as well is right in this same area for that road construction that we discussed. Just an extra topic I like to throw in anytime that the county schools get mentioned. There's also another school that's going to add traffic that is not part of these conversations.
So you guys, y'all don't phase the extracurricular activities.
No,
I'm
sir.
seeing the
No.
charter schools phase them.
Yep.
Of course, y'all come ready-made full.
Yep.
They're starting out
We
at
absolutely do, yes.
150 kids, and then every year they're increasing, and they won't be at capacity for 5 years. Anybody did 5 or 6 years, sometime down the line. You guys started capacity, I guess,
Yeah,
right?
I will say their application, I was the person that reviewed it in this commission at that time. I think 21-0 opposed it, and so it's a very interesting relationship, to say the least. That's why we're not their authorizer, but their application was to be full at the very beginning, and they're just not doing that. But they're authorized by the state now, so we have no say-so in whether or not they follow that. So.
Thank you, Chair. But one of the things I want to emphasize is this month and next month, I want to emphasize, as far as the commission is concerned, we're a funding body. We're not here to discuss the curriculum or anything to do with the schools other than the money comes through here. We're charged to spend it on the taxpayers' behalf. So I would like to make sure we're keeping the conversation, because the reason this is important, and I'm sure people are watching tonight and they will watch, because this is the first time we've actually had emails about a Health and Ed upcoming meeting, and I'm going to tell you why. People want to know why there's a cost difference. So this is an excellent sheet. I'd like to request that I think this needs to be posted for the public to view. Yeah. The public deserves an answer on why they're hearing that a charter school with 800 kids potential is half the cost of what they need to know. Because what's happening is, and I'm not going to speak on behalf of my fellow commissioners, but I guarantee they sense the same thing I do. There's a growing pressure on us to answer the questions. And we're not all experts in every single thing that we vote on. We have to go discover the reasons why. This sheet is an excellent start, is to say we are building buildings that are going to last, because if not, you're going to have the problem come back in 20 years, which, by the way, is not very long. Whatever the cost of anything is today is going to be far more expensive in 20 years. So we're basically, you're saying we could have to rebuild a building of less quality 3 or 4 times as long as building it once correctly. But here's the thing. We've got to have public buy-in. The public and our constituents have to agree that, because a lot of us won't be here as long as these schools will. That's the truth. So we need people that are willing to invest in the future of this county long beyond our own lifetimes and into our kids and grandkids and great-grandkids. So we have to hit this head on. We have to continue discussing it on why there's a difference, what they are. And I feel like, including yourself, we're all in public positions. So I think we have to over-communicate and overemphasize the importance of discussion of every penny. And we're not going to spend more dollars than I think we are on school buildings. I think that's our biggest, especially in a single vote, that's our biggest expense we're going to have. So moving forward, I just wanted you to know that this is not any type of anything negative about the Board of Education. This is simply, these are the questions we're being asked. We need to get the answers and say to people, we're looking out for the future of the county. And if we believe that it's better to build a higher quality building at the standard, so it's not going to come back and have to be rebuilt by our future kids, grandkids, great-grand, we're going to have to tell them why and get public buy-in.
Great.
So I just want to put that out there. So this, if this could be made public,
That's fine.
I think this getting out is a good step for us to say the conversation is about how long the investment will last, and I think that matters.
Great. I think the other part I always like to add is, if you see a column, it's not our building. I always like to say, if you see a column on a building, it is a city schools building. It is not ours. We don't have the columns going across the building. So we always get accused of building the Taj Mahals, because that's what people drive around, and those Taj Mahals are not ours. So we're still building the same ones from 20 years ago.
I actually forgot one follow-up. There has been kind of out in the public a belief that we won't build up. But what I hear is we are willing to now be more flexible, and in your conversations, we're talking about building a higher level school, because that's a great, I mean, these are things people need to hear, is that we are not sticking to something, but we are considering doing something imperative and new and good. So I think that's a great step in the right direction.
Yeah, Poplar Hill will be 2-story. The elementary school will be 2 for sure.
And that's something else. I think we have to refer to the Beatty property now as Poplar Hill. That will be what we call it moving forward. We've been calling it Beatty property for a long time. So.
Yeah.
I have a couple of questions, just since you're here, Dr. Sullivan.
Yes, ma'am.
Just because of questions that have come to me, and it's not on budget, but I've had citizens that commend the fact that the school board did the resolution relative to not doing the and I had 2 come to me to ask the question, will you all have the ability to be able to just refuse?
To refuse which?
Refuse if teachers wanted to carry guns.
Yes, the way the bill is.
Because of the resolution.
Yes, the way that the bill is written so that it requires the chief local law enforcement officer So we've had some discussion.
Right.
All of our buildings are county buildings. So in working with Tennessee School Board Association and the Tennessee Organization of School Superintendents, they should all be county buildings, even if they're in the city limits. So that was our first, or we're going to have to deal with 4 or 5 different municipalities. So they're all county buildings. It requires the sheriff and the director of schools to sign an MOU and the principal. And I don't envision that happening. So I won't say on whose case or where, just to protect everyone, but I don't envision that happening. Part of that is because of how great a relationship we have with our sheriff, and we have SROs in every building. Not everywhere has that case, and in private schools, that absolutely is not the case.
Okay.
Can I ask a question about that? Are you going to move to another topic?
I was, but you can follow up with that.
As far as you know about the law, a teacher would have to apply.
Correct. They would have to apply. There'd have to be an MOU with the sheriff.
Right.
And
So nobody's mandated to,
No.
okay, you're going to carry, you're going to carry.
No.
It's just, okay.
yeah, you have to, and the version, part of the version, the way that we read it, there's specific stipulations, and there's even some argument that it has to be a retired or former law enforcement officer is one of the only ones that can carry. And so that's in the Senate bill version. But it does require an MOU between the sheriff's department and the school system. The state waives, in that legislation, waives state liability. It does not waive federal liability. And so that is a huge concern of federal liability for the sheriff and myself.
Okay. And one other question came to me, considering your book review board. What would be the reasons that a book would not go before the board and a sole person could make a decision to remove a book?
So we've had a lot of conversations around that. So we have TCA 391017. No, I told you 17901. You got it. 3917-901, which is the obscenity law. And so the way our board policy is written, it has library review committee, which are books that are brought about through the official library review committee. And then there's also a section that talks about official, not official, violations of the obscenity law requires immediate removal. We have not removed immediately. We've reviewed them internally, but they have not gone through the official internal review committee because of the way the policy is written. And so we've discussed that. There's been some News Channel 4 articles about it. And then every time we get one, I have an email that is ready to go out about the last look of reviews that I haven't had a chance to send yet. So that's where it comes from. Our policy hits 2 different
So
areas.
then is there a need for the review board then? If that's not going to be utilized?
I think if it depends on if somebody wants a book to be reviewed that may not meet something of obscenity, that may just be not age appropriate for whatever reason that they have. One that comes up quite a bit is a book that I love, is The Giver and Hatchet, come up quite a bit. Those probably wouldn't meet obscenity law violations, but they could meet a challenge as is this appropriate for a grade level.
Thank you.
Commissioner Phillips, Chairman Phillips, any comments? I believe Jimmy's wrapping up.
Only comment that I've got is I'm older than a lot of our schools, and I remember when Smyrna High School was built, which is now Smyrna Middle School, opened up, if I'm not mistaken, in 59 or 60. And if you look at that building, it looks better than most of the high schools that are less than 20 years old in Nashville. That's the reason for spending more money up front. You put a better lighting system in that lasts as long as a school is. You put a roof on that's pitched versus a flat roof. We've learned all of those things through the years, and you spend the money up front, and you don't have to spend a tremendous amount of money every year maintaining those buildings, and you have something that will last for generations and not just for a generation. If I dare say something like this, Siegel High School is how old?
21. Siegel High School.
How old is Siegel?
21 years this year.
21, and Antioch High School was built in that exact same time frame, and it's a metal building. Go look at Antioch High School and look at Siegel High School. You'll be sold. So what we've learned through the years is that we're not excited about spending a tremendous amount of money, but we are excited about the traditions that go along with Laverne High School, Smyrna High School. You talk about Eagleville High School. Those communities have pride in those schools, and that particular pride pays off long-term if we put the investment in that school that will make sure that that pride continues forever and ever and ever. So paying the money up front is difficult, and I mean that is extremely difficult. But you talk about saving money for generations to come. It's best to invest in that future rather than to invest something that you know is going to last not much more than a generation. Classic example, Commissioner Boyd, and my ears perked up 2 months ago in a purchasing committee meeting when an engineer said, I'm designing a school in Coffee County, Bedford County. It's a middle school and it's costing 32 or 34 million bucks. And we said, how are they doing that? And the answer was, it's a metal building. And we've also got some experience with some of our county commissioners that join us that have experience with metal buildings. Some of those metal buildings were built back in the 1970s and no longer exist. They no longer exist. They're worn out and torn down and replaced. So I don't know how to say it other than who enjoys spending 80 million bucks versus 40 million bucks for a middle school. But if it lasts 4, 5, 6 times longer, it's a lot cheaper in the long run to do that, especially the way costs continue to go up and up and up. And things that we continue to learn, the way we heat and cool our school systems now. And once again, the pitched roofs versus the flat roofs save a tremendous amount of maintenance long term. So it costs a little bit more up front, but it's a lot less expensive long term. So,
Thank you, Chairman. Yes, sir.
So I appreciate that. I happened, Bedford County taught me a lot. I was a principal there and opened, well, I didn't open. I was a principal there 3 years after one of those new buildings opened. And then moving to Rocky Fork to open, some of the things that are not included, I had to do a fundraiser to add a PA system to my auditorium and to my gym because there was no way to call an emergency. There was no lighting. There's those things that some of our people take for granted, so I want to thank the commission because those are things that are not done everywhere. Didn't have a projector anywhere, didn't have, there's a lot of things. Phones in classrooms, they don't exist in other places. And so I know we may just think of them as just customary, but I realize that's an extra cost. And we still are trying to build them. I know that the Poplar Hill Elementary came in lower than surrounding schools from other districts. So that's what we're still trying to do.
I don't want the public to think that we don't wish to hold your system accountable, though. We certainly are supporting building schools to last as generational buildings, but we don't want to overlook the mandate on all of us to design well, look for ways to get needs, get not wants. So I'm sure we will continue to look for those things as well.
I feel like you guys do a great job of holding us accountable. Great job.
I think that's our job.
It is your job. You're correct.
So Dr. Sullivan, thank you.
Thank you. We do have graduations that start happy time of the year. So graduations start May 10th, I believe. Wow. Unfortunately, we do have them during a county commission meeting. So we are given our dates by MTSU, and we have to go by what dates they are. We just try to rotate so it's not the same high school every time. So I believe this time's Laverne, and so I apologize that we organize by smallest to largest. The next year we do largest to smallest, so we will alternate it. Last year, I think Laverne was on Mother's Day was last year, so they all alternate. But happy time of the year.
Thanks, Superintendent. Next on our agenda is other business. Is there any other business?
I just have a quick announcement.
Yes, sir.
This is in regards to this weekend. I know Commissioner Wilson has been working really hard with his committee of Jazz Fest. It's this Friday and Saturday. So I would encourage, if you can, go and support it's a lot of our schools that are participating in it. So Friday it starts at 6 p.m. and runs to 10 o'clock, and Saturday from 11 till 6 p.m. So let's go out and show support to these individuals that, in jazz band, all types of bands and drumline.
Is that the Fountains again this year?
At the Fountains.
That's correct. If you said that, I missed it.
Sorry,
So
no, I
do
didn't
note
miss
it's
it.
moved from the square back out to the Fountains.
That's correct. Yep.
Meeting adjourned.